Results-Oriented Management and Accountability, or ROMA, is a performance measurement and management system designed to help community action agencies improve their abilities to achieve and demonstrate results. ROMA gives community action structure and support in efforts to continually assess and improve programming, tell our story using compelling information, and present data on a similar nationwide platform. ROMA encourages a culture of continuous improvement and data-driven decision-making. Before you can understand what ROMA is today, it's important to review where it started. In 1964, Congress passed the Economic Opportunity Act, establishing and funding community action agencies as part of the war on poverty. In 1970, the Office of Economic Opportunity, which was the agency at the time that was responsible for administering most of the war on poverty programs, established the mission and the model of community action. The agency is now the Office of Community Services. In 1981, after Ronald Reagan was inaugurated, the Community Services Block Grant, or CSBG, was created. This changed the regulatory and funding basis of community action agencies. The federal government's role was now mostly limited to funding, while states became active administrators with responsibilities for planning, fiscal management, and reporting. In 1993, Congress passed the Government Performance and Results Act, or GPRA for short, mandating all federally funded programs be able to establish performance goals and measure results. The idea was to improve federal programs' effectiveness and public accountability by promoting a new focus on results, service quality, and customer satisfaction. In response to this, the process of ROMA was developed. In 1994, the Monitoring and Assessment Task Force, or MATF, was created by the Office of Community Services to explore the reported results. The task force then produced the 6 national goals that shaped community action for years to come. Those 6 national goals were: low-income people become more self-sufficient, the conditions in which low-income people live are improved, low-income people own a stake in their community, partnerships among supporters and providers of services to low-income people are achieved, agencies increase their capacity to achieve results, and low-income people, especially vulnerable populations, achieve their potential by strengthening family and other supportive systems. In 1998, the CSBG Act was reauthorized. For those who don't know, that was the last reauthorization, and community action has been operating on continuing resolutions since then. In this reauthorization, a specific reference to performance-based reporting was included. Mandatory reporting was effective as of October 1, 2001. In 2001, Information Memorandum 49, or IM 49, was published. This is the document that most clearly defined ROMA. It is the public policy document that sets ROMA within compliance under GPRA and provides guidance for both state CSBG agencies and the CAAs for managing client activities and reporting results. In 2005, the implementation of National Indicators of Community Action Performance became a mandatory activity for services delivered after July 1, 2005. The original NPIs were organized around the 6 national goals as a standard way of reporting. In 2006, the ROMA psychographic was created to help reinforce the concept that ROMA included the full range of activities identified in IM 49. In 2015, after an initiative led by the Community Action Partnership to identify the key elements of agency performance, they worked on new ways to state these elements in a way that they can be measured. Among those, the new National Theory of Change was developed. The Office of Community Services also addressed the GPRA Modernization Act on inclusion of customer satisfaction data by conducting the first American Customer Satisfaction Index, or ACSI, survey of eligible entities and state offices. Also, IM 138 was issued to guide the implementation of the 58 new CSBG organizational standards. All of the ROMA principles and practices are embedded in the organizational standards, and many of them are directed at the actions of the CAA Board of Directors. Then, in 2016, the network worked to reformat the reporting processes, and in January 2017, the new CSBG annual report was approved. Now we can discuss where community action is at today. Pictured here is the National Theory of Change as of 2017. A theory of change is a brief expression of the assumptions that underpin the network's actions. Identification of the areas in which the network will provide strategies and services, and the expectation of excellence of the network that will convert organizational and financial resources into the desired results. It provides a conceptual roadmap for how an organization expects to achieve its intended impact. Now we will discuss a brief overview of what the ROMA cycle entails. Here you can see that the diagram of ROMA is shown as a circle because our planning and evaluation process is never ending. We are always looking to improve on our current efforts and strategies, and it helps us ensure that the goals we are currently working on are still timely to the clients that we serve. We start at the assessment part of the cycle. This is where our agency reviews its mission statement. According to Peter Drucker, the effective mission statement is short and sharply focused. It should fit on a t-shirt. The mission says why you do what you do, not the means by which you do it. The mission is broad, even eternal, yet directs you to do the things now and into the future so that everyone in the organization can say, what I am doing contributes to the goal. Since you have a mission statement, you are also indicating that there is a perceived need for your services and efforts in your community. This is where your agency's community needs assessment comes in. Your community needs assessment helps to narrow down the highest priority needs in your community and tells you where your resources are most needed. Once you have assessed who you are, what you do, and what your community needs, you then move to the planning phase of the ROMA cycle. Now that you have the highest priority needs, and because community action is results-oriented, you then plan for and identify the appropriate outcome you are working towards. You do this first, before determining what service to provide, because you are focusing your resources and ensuring that your current efforts are going to get you your end result in the most effective and efficient way. Let's cover a brief example of matching your need to the appropriate outcome. In your community needs assessment, you determine that one of your highest priority needs is that families lack affordable housing. The outcome or change that you're looking to accomplish is sweet and simple. It's that those families obtain affordable housing. Now that you have a clear need and a clear outcome, you can plan the service that would be effective to obtain that change. Using that example, this could be services like providing housing counseling and security deposits for a new location. In the third phase of the ROMA cycle, we move to the implementation part of the plan. Planning and implementation is a core responsibility of the Board of Directors, and therefore your board members must be active participants. During implementation, we measure areas that indicate our efforts towards our outcomes. There could be a single outcome indicator for your outcome in mind, or there could be multiple. In the housing example, an indicator that could help us measure whether we are obtaining our outcome is 8 out of 20 families will receive housing counseling in a 12-month grant period. As a reminder, we use the National Performance Indicators, or NPIs, to help standardize these measurements across the country, but they are not a catch-all for every agency, so there may be indicators that you can report that don't actually fall under the NPIs. Next, we move to the fourth phase of the ROMA cycle, achievement of results. Here we focus on the evidence we have received and analyze proof of accomplishments. The staff at your agency will use tools like outcome matrices to measure the performance of an individual client across all services of your agency. This is the intent of IM 49, which focuses on the client's progress and not your service. Tools like outcome matrices allow for aggregating data. For example, if all case management clients were using a tool like this, the agency could determine overall success and overall barriers, and where interventions were most commonly needed and not needed. Combined with individual client characteristics, the agency could then begin to determine who benefits from programs and services, how long it takes to achieve those goals, where overall barriers exist in your overall community, and what interventions will work. Finally, in the fifth phase of the cycle, we move to evaluation. Here, your agency reviews all of the work and asks, did the intervention have the desired results? Did we obtain that outcome we identified earlier on in the cycle? Let's quickly return to our housing example. With tools that your agency has access to, like logic models and outcome scales, the agency can ask what is, and what is not, the most effective combination of multiple services for our clients to obtain this affordable housing outcome. After this evaluation, you then return back to the assessment part of the ROMA cycle, ensuring that the services and programs you are offering are continuing to be applicable for your community. So, what does ROMA mean for Community Action Agency's Board of Directors? When you plan, you seek to do more than ensure a secure future for the agency. You also set goals for how the agency will change lives and make an impact on the causes and conditions of poverty in the community. ROMA is about results, not just services. It is important for the board to understand why a results orientation is the focus of the new performance management climate. It's important to show the whole picture, and reporting on services is not everything in an agency. When you only focus on reporting on services, you are looking at what CAAs have historically measured. These are things like the number of food baskets distributed, the number of children attending Head Start centers, or the number of families receiving WIC services. These numbers do not tell us how these clients' lives are truly changing, which is important because community action helps people change their lives for the better and helps communities become better places to live. CAAs are change agents, not simply service providers, and the change we focus on is the transition to self-sufficiency or even achieving stability. We try to help people in multiple areas so they can realize their dream fully. To understand the importance of ROMA, we will use an example with baseball. The situation is that the team finished last in the prior season, so to boost dwindling attendance, the team promotes that outfielders ran 3 times more laps during spring training, batters took 4 times as much hitting practice during spring training, and the team hired 2 new coaches and invested $100,000 in a state-of-the-art communication system to enable the manager to talk with them so they can give real-time perspectives. And the fans say, so what? Because they're still in last place without a single player who deserves to be on the All-Star team. The fans don't care about the process if they don't get the results. They care about winning. Now, in the community action world, the board of directors is like the owner of a professional baseball team. And the executive director is like the manager of that baseball team. The funders, the community, and the clients are like the fans who want to see the results. For community action agencies, changing lives and improving communities is how we score runs and win games. If all we tell the community is how much service we provided, instead of what came of those services, is it no wonder that our fans may also say, so what? Outcomes are real results. They are changes to the client. That's like receiving a certificate to show an advance in education, or obtaining reliable long-term transportation, or even opening a new business. The benefits of using ROMA are stronger programs directly tied to needs in the community. The agency knows exactly what results it wants to achieve, and the agency can explain exactly what the results of its programs are. And being able to show those results is critical because it improves your agency's public image because the public can understand the change you are making. And the results can also be accumulated to show impact across a larger region, like the whole state of Wisconsin or the entire United States. And there is power in numbers. For example, by aggregating the data from community action agencies across the United States, the National Community Action Partnership can report that Community Action's reach covers 99% of America's counties, serving all 50 states, the District of Columbia, and Puerto Rico. CAA weatherization and energy services are valued at $123 million in anticipated utility savings. And 44 million volunteer hours were donated to CAAs, and those hours are valued at just over $1 billion. Therefore, the process of ROMA can truly help us share our story and illustrate the difference we continue to make on people and communities across the United States.